Thousands of Minnesota seniors are trying to figure out what to do with word today that Essentia Health is dropping some Medicare Advantage insurance plans.
Essentia's reasons: too many claim denials and too many payment delays. Morgan Wolf is here to explain who is directly impacted and what's next.
Yes, well, this will have a significant impact on people with United Healthcare's Medicare Advantage plans. So this will impact roughly 20,000 patients in the Midwest, 14,000 of them right here in Minnesota.
Essentia is parting ways with the largest healthcare company in the United States, United Healthcare and Humana. They'll work with them on their commercial plans, but are no longer going to be accepting their Medicare Advantage plans.
Began discussions with United Healthcare as far back as October of 2023.
Essentia's chief medical officer for population health says that this wasn't a decision that was made lightly. Ultimately, Essentia says that UHC and Humana were too often denying or delaying care, adding that they want to provide more timely and appropriate care to their vulnerable and elderly patients on their Medicare Advantage plans.
We live in a rural footprint. We serve a rural footprint for our patients. So many times those patients would have to drive back 2 hours to home to wait a couple days to get the approval, to only have to drive back to get the testing a few days later. That's such a hardship on the patient and their families.
Those with a UHC or Humana Medicare Advantage plan can choose an alternate option during Medicare open enrollment, which is going to be starting next month on October 15th. Patients are encouraged to verify that any new plan is in network with Essentia to prevent any gaps in care.
UHC sent me a statement today saying that they hope to renew the relationship with Essentia, adding that they extended a contract in July with them for existing Medicaid, Medicare Advantage, and employer-sponsored health plans through the end of the year, adding that part of the agreement was to collaborate on items, none of which they said were specific to Medicare Advantage. UHC says, quote, Essentia Health didn't raise concerns regarding its participation in our Medicare Advantage network until last week.
Thank you, Morgan. And this isn't the first time UHC's Advantage plans have been dropped. Health Partners did the same thing this summer for the same reasons. Health Partners claimed UHC's denial rate is 10 times higher than any other insurer in this market.